Hi, I'm Julie Chin. Hospice care can be a tough topic to talk about, but it's something that has helped thousands of families in northeastern Oklahoma during one of the most difficult times of their lives. We'd like to share with you what hospice is exactly, how it helps a patient and a patient's loved ones, and we'll step you through the entire process involved in choosing hospice care. We begin with Amy Musgrove, Education Coordinator with Grace Hospice. So what is hospice?
Hospice is an alternative level of care compared to healthcare environment where you're going to the hospital and going to the doctor's office. Hospice care provides more in-home services for people that are deemed to have a terminal illness, and it provides more support and pain control, and that's what they focus on rather than curing the actual disease.
Who qualifies for hospice?
Anyone that is just been determined to have a life expectancy of less than 6 months, and that is determined by the physician. You know, there's this myth that hospice means that you are just days away from dying, and that's not always necessarily the case. The ideal hospice environment would be to be admitted to the hospice services and start getting that care before you're really in a state of crisis. If we can, get in there ahead of time and, help you with the planning and get the patient's, pain under control and meet those needs, a lot of times we can extend their quality of life.
Who can benefit from hospice care?
Everybody can benefit from hospice care, patients and families. Benefit obviously for the patient is that their comfort's going to be improved and their pain will be under control. Benefit for the caregiver is they're going to have the extra resources that they desperately need and sometimes they're not aware of.
How do you know when it's time to turn to hospice for care?
Well, your physician's going to let you know and communicate that to you. And so when the time comes, it's as simple as contact your doctor and we arrange a time to come out to visit with your loved one and you and go through the criteria. It's a pretty quick process and hopefully you'll learn a lot and find support from it.
Hospice care is a team approach with the help of physicians, registered nurses, home health aides, chaplains, social workers, volunteers, pharmacists, and bereavement counselors. Just one phone call can activate this team?
It is as simple as one phone call and we can get everything going.
What if it's 2 o'clock in the morning on a Sunday?
If it is 2 o'clock in the morning on a Sunday, still pick up that phone. We are there 24 hours a day, 7 days a week.
Where is hospice care provided?
Hospice care is provided in the home. It's also provided in nursing home facilities and assisted living communities and hospice facilities. Typically the family member is the primary caregiver, whether they have hired caregivers that are in the home, but they are the primary provider. Frequently our home health aides can be in the home 3 times a week because they're helping with the bathing and the dressing and all the stuff that helps with dignity. And chaplains and social workers, they come again according to the patient's preference and the family's preference. Maybe just the family wants support from the chaplain. Some patients are doing fairly well and pretty stable, and maybe they just want a nurse visit once a week, and that's perfectly acceptable. We just meet the needs of the patient as they define them. So it really is individualized.
My father had Alzheimer's disease, and as we approached the end and we had moved him into a facility to help, he needed some extra help and we felt that he was declining and that it would be a wonderful support for our family to make sure that his needs were met where he was living. They provided everything that we needed and could meet our needs in ways that we didn't realize they could. So we had challenges, even challenges that we didn't know hospice could help us address. They were there to help us get through those steps and to provide the best care for my dad. Hospice made losing somebody much easier and at least took a lot of the fear out of the process. When we had gone past the part of all the care and the daily needs and the medicine and you come to the end of that road, having somebody with you that can help explain what's happening and help provide comfort and tell you what is normal during that process gives you a lot of peace of mind. And then also providing the needs that come after that. So, all the arrangements and having somebody there helping to hold your hand and to do things as you should is absolutely priceless.
When a hospice worker comes to your house, let's say, to help, are you free to leave? How does that work?
That's kind of unique as well. Typically when the nurse does come to your house, you're going to want to stay because the nurse is there to give you valuable information about how the patient's doing and, or have any kind of discussions, because as a caregiver, you're going to have a lot of questions, or the patient's going to have a lot of questions. That's really where our volunteers come in though, and that's the importance of that. They are great for companionship, and as a caregiver, if you need to get out for a little bit, the volunteer can be there to stay and make sure the patient's safe and their needs are met. If the more resources you have to be able to go and do stuff on your own, because your life doesn't just shut off either, and we provide you that support. So because we want to not just improve the patient's quality of life, but we want to make the caregiver's life improve too, because every moment counts with the family as well.
Hospice is really full service from the time the doctor says it's time to even after that loved one passes.
It is. There's a continuity of care with that. It's very important because, again, it's not just about the patient. It's about the family members as well and the caregivers, and making sure that everyone gets the support they need. It's easy to be scared of hospice, and we understand that, but you need to look at hospice more as, it's planning, and that's, and this is a journey that we're all going to go on. And the more, team members you have, the sweeter the victory is going to be.
You've been given a lot of information about hospice care now, and you're probably wondering, how do you pay for it? Medicare, Medicaid, the Department of Veterans Affairs, and private insurance can cover hospice care.
Some patients with no insurance can receive assistance from the Grace Hospice Foundation.
You can determine if a hospice is right for you by talking to your doctor, interviewing different hospices, or asking someone you trust who's familiar with hospice programs in your area. You do have choices when it comes to hospice. Hospice care is designed to help a patient and their loved ones, providing them support, comfort, and the best quality of life during a time when they need it most.